How we approach the ectopic pregnancy? When someone is present with the early pregnancy with pain and bleeding. So let's see what is, if she is stable or not stable. If unstable, simply go for the surgical treatment for suspected ectopic pregnancy. If she is stable, then you go for the ultrasound. In the ultrasound, what you want to see? You see either it's a intrauterine pregnancy, then of course you give the expectant only. So this is the option. If the intrauterine pregnancy is abnormal, then you go for the DC, mean dilatation and curettage, or if in the medical you can give the misoprostol. Okay. If the case is the ectopic pregnancy, of course you treat the ectopic pregnancy either medically or surgically, which I mentioned in the last slide. What is fourth condition? The patient is undiagnosed or the pregnancy of unknown location. So which is in the 40% cases of ectopic pregnancy on the first ultrasound. Okay. So then you go for the beta HCG. What you see in the beta HCG? You see the discrimination zone, if it's greater than discrimination zone or not. Okay, so what is discrimination zone? As I mentioned, 1500 for the vaginal sonography, and for the abdominal it should be more than 3500. Okay, so if it's greater than that, what is the next step? You go for the dilatation and curettage. If the chronic villi is present, spontaneous aborted mean. No need to treat further. Okay, and if there is no chronic villi, then you go for the medical or the surgical treatment. Okay. If the beta HCG is less than discrimination zone, you should follow the beta HCG and compare it. Compare with the previous one. What is happening? It's normal fall, then mean no treat needed. Okay. If it's normal rise, then wait until it reaches the discrimination zone. Okay, then you confirm your diagnosis and go for what is needed. If you see there is abnormal rise or fall in the beta HCG, then you go for the dilatation and the curettage. Okay, so this is all about the ectopic pregnancy. Thank you very much. Allah Hafiz.